Hello everyone. I mentioned in a previous video that I would make a video about stuff that I bought prior to surgery or bought after surgery that I needed. Recovery wise, I apologize for the shaky camera. I have to hold my phone. Um, but yeah, I'm just going to go over stuff that I've been using during recovery that would be smart to either buy beforehand or just make sure that you have some already on hand for when you get home. First of all, I just got some gloves. These are latex free, I think. They're not sterile, so these are for me because I don't inject testosterone. I've been using androgel for the past year. And I was worried being in the hospital since I couldn't get out of bed. I couldn't get up to wash my hands afterward. I needed gloves so that I could just take the glove off and throw it in the garbage after doing my testosterone on myself. Yeah, that was just basically for the testosterone. So if you, like me, use a topical testosterone, and you're not going to be able to wash your hands or get up to wash your hands afterward, I highly recommend getting some gloves that you can just throw out afterward. It made it so much easier. I would have skipped my testosterone every day because I wouldn't have been able to get up and do it properly. So that's been really helpful. The other thing that is extremely helpful is a mirror. And this is just from the dollar store, and it's quite large. You're going to need a mirror to see all of the different things going on downstairs. All of your stitches and incisions you need to keep an eye on for infection. The mirror is awesome. Also, it helped because I couldn't get out of bed to see a mirror in a bathroom or anything. So I was able to use the mirror to, look at my face, to wash my face properly or whatever I needed to do. The mirror was just super helpful. You're also going to need some unscented soap. Mine just happens to be a Dove bar of soap that I already had. I had a couple of these, thankfully. I would say get a few bars of this unscented soap. This is to wash the surgery sites, to wash the leg where the skin graft was taken, to wash your arm scar, and to also wash your genital area because you can't have scented soap products on those areas. So I've already almost gone through a bar of soap in the past month, so I'm going to be opening this one soon, and then I'll probably have to buy another one after that just to continue with my arm until it's completely healed. You're going to need some medical tape to tape the catheter to your leg during your shower. I haven't used the tape for anything else, but during those first few weeks, it's actually only about 2 weeks or so, because by the time you're able to shower a week post-op, then you only have 2 more weeks with the catheter in. Or at least my surgeon, that's how they do it. So I use the tape to tape the catheter to your leg so that it's not just dangling and pulling, because that hurts. Then you're going to need, or at least this is what I was told to do, is use a needle to puncture any blisters or anything on your arm scar to release the fluid after your shower. After you've let it dry for an hour, then you see pockets of fluid that you want to release that fluid so you don't get infected. I don't have any more of this type of needle, so I've been using my old testosterone needle heads, which I probably shouldn't have been doing because they're a bit larger than this, but it's been working fine. So I had a bunch of these lying around, so it saved me a trip to find this type of needle because I already had a bunch of those needle heads lying around, so I just used those. This is like hospital underwear. Thankfully, I got about like 7 or 8 pairs from the hospital. So I'm still wearing these. I'm over 5 weeks post-op now, and I'm still wearing these. There's so much leaking of pee and blood and gross stuff happening that I'd rather just dirty these. These also dry really quickly. You're very, I apologize for the movement here. You're very wet down there because of just all the fluids happening, that these dry super quick. I found that the days that I have been wearing just my regular underwear, they get so wet within a couple hours, and then they don't dry, they just stay wet, and then you just feel gross. So I've been just wearing these. I don't know if you can buy these from anywhere, but if you can, and you find that you really like wearing them, and the place that you go for surgery doesn't give you like 8 pairs, then I would suggest trying to hunt those down. Next, I just have a pair of, like, they were sterile, but they're not anymore, scissors to cut the gauze and everything. These work great. I sterilize them with alcohol swabbing pad things. But yeah, they're great for cutting gauze because that's what they're made for. Next, polysporin. I bought too much. Somebody told me I would need a ton of it, so I went out and bought 2 of these packs. I didn't even use a full one because of the amount of free polysporin that I got from the hospital. I didn't use it. So this was for my leg. The graft on your leg, for the first few days, you have to, after the initial bandage comes off, you have to put polysporin on it and then put the Telfa gauze, which I'll go over in a second, on top of it. But you only do that for a few days until the pain of the leg is gone down, and then you switch to the vitamin E cream. This is from Walmart. It's been working well. I've used about half of it already on just my leg. I haven't even, like, the scars on my genitals haven't closed or anything to the point where I'm supposed to start using this yet. So I would suggest, you're going to need a lot of vitamin E cream. So I'm going to go have to buy some more soon. But yeah, that's currently only for my leg, and I do that about 2 or 3 times a day. Whenever I feel that it's dried out and I need to put more on, that's when I do that. Next is just baby wipes. I bought, this was a 3-pack. I've gone through, I think, 3.5 packs of baby wipes already. Use them after you go to the bathroom to make sure everything is cleaned out properly. I use them just in general throughout the day to clean, especially the scrotoplasty area, because of where the urine is coming out. I'm missing a lot of it somehow. Maybe it's just leakage throughout the day as well. Just wiping that kind of dried urine away from in between your thighs and your scrotum and all that stuff, it's just easier. I used the wipes while I was still in the hospital before I could shower. I was wiping my face with them. I was wiping my armpits with them, just trying to wash my upper body with them. Yeah, they're awesome. I would highly suggest it, and I'll be using those for probably months to come, because they're just, especially for the bathroom, to ward off infection, making sure everything's cleaned properly. Also, these are unscented, and I think that's really important. But these ones just have aloe in them, but they're unscented. I would suggest that over the scented ones. But yeah, baby wipes, definitely important. Next is adaptic dressing. This is for your arm, and it's to put on any wet spots, any spots that are leaking on your arm, so that when you put the dry gauze over top, it doesn't stick and then pull and rip your graft. So basically, you cut pieces of this, cover parts of your arm with it that are wet and open wounds, and then you take the 4x8 gauze, which looks like this, and it rolls out into like 3 sections, which I've shown in a different video before. You take this gauze and wrap it around, and then you take the rolled gauze, which is back there, which I'll show you in a second, to wrap it around. But basically, this is very important. I bought about 7 of these. They're quite expensive. They were about $1.50 or something each for like this small little piece. I bought about 7, and then the hospital gave me a few. I'm slowly going through it. I would say don't go overboard on this, because they're expensive, and what else are you going to ever use this for? I don't know. So I bought, I think, the perfect amount. I have a few more sheets of it, and I think that I'm only slowly going through it now. At the beginning, when the scar was really bad, I was going through more of it, but you'll kind of get an idea of how much you need. I would say make sure you have some for when you come home, but don't overbuy too much of it. Next is, like I said, the 4x8 gauze. This was impossible to track down. It was so difficult. These are not carried in like general pharmacies or anything like that, because this is like a hospital grade gauze. They're quite large, as you can see. Nobody uses these. So basically, I went to my local hospital. There's a few hospitals in my area, and I found them there. But I had been searching, I couldn't find them online anywhere that would ship to Canada. I couldn't find them anywhere because you have to get the sterile ones. This is going on your arm, which has to be sterile. So I found packs online of like 1,000 for hundreds of dollars, but they weren't sterile. I wasn't going to buy that anyway. But these ones I found, these are 65 cents for a pack of 5 at my local hospital. So I bought a ton of these, and you go through these like crazy. You use these for your arm. So I use 2 a day for my arm, and then I also stuff these in my underwear to stop or to catch all the leaking stuff. So you go through these like crazy. I've gone through, I think, about 20 packs of these 5 ones already. And I've gone through, the hospital gave me a whole box of packs of 2, which I've already gone through. And I have to go back for more of these in a few days. So you can't really overbuy these. I would say if you buy like 50 packs of this, you're still going to use it all. But that I found those at the hospital. This, the Adaptic as well, was from the hospital. And then I bought this box, which is, I'm going to start this box tomorrow actually, because I've run out of my other box of them. I bought 4-inch ones, but these are the rolled gauze that you wrap around after you've put the 4x8 gauze on your arm. You use these. So I went through a whole box that the hospital gave me, and I'm about to start this box, and I still have about 2 months of wrapping my arm to go through, so I will probably have to buy maybe another box of these. I would suggest the 4-inch. The hospital gave me, I think they were 3-inch, which means you have to wrap more, which means you use more, whereas the 4-inch wraps more around your arm because it's longer, so you can get more use out of them. But yeah, so this is a 12 pack. So I would say get at least a box of those, and a couple boxes if the hospital that you go to doesn't give you any, then you'll need a couple boxes. This is, I'll start with this, I guess, because we already talked about it. This is Telfa gauze. I didn't buy any of this. The hospital gave me enough of it that by the time I didn't need it anymore, I still have this and one more left. There's just one. You can't really see what it is, but it's a very bizarre plasticky gauze that you put on your leg after you put the polysporin on it. This is so that it doesn't stick. It's a non-adherent, as you can see, gauze that you just put over top, and then you put this net thing over top of your leg to keep everything in place. But I didn't buy any of this. Somebody told me before surgery to buy some of this, and I couldn't find it. I didn't look very hard, but I didn't buy it. And I'm glad I didn't, because I would have wasted my money, because the hospital gave me enough of it anyway. But yeah. Next is 4x4-inch. There's 2 of them in here. I currently am getting these for free from a clinic I'm going to who's helping me with wound care right now, but I'm going to go buy some of my own of these 4x4s because I'm finding these are good for also putting in my underwear to catch any leaking. I'm using them to do my saline spray every day to clean up the saline after I've done that. It's just good to have different sizes of gauze. The 2x2s here, again, they're 2x2 inches, or 2x2 inches, and there's 2 of them in here each. I've gone through about 5 boxes of these already. Thankfully, currently I'm getting them for free from the clinic I'm going to, but I did buy a couple of my own boxes, which I've already gone through. These are perfect for smaller wounds on your genitals that you're trying to cover, so that it like soaks up any of the pus or gross stuff that's coming out of them. I use these after I poke my arm with the needle to get all of the blood or anything or pus or whatever's coming out of my arm to dry it up before I put the Adaptic on. Yeah, I've been using these for literally everything, so I would definitely suggest 2x2s. Get a few boxes of these. Next, this, I don't know where you would buy this. I haven't looked for it. I'm getting this for free from the clinic. This is what the clinic I'm going to, the nurses have told me to be putting on I talked about I had a hole on my underneath the phallus, um, which has now healed. But this is what I was putting on. It's called Bactograss. You put it on the wound, and it basically, it's got medication on it that pulls all of the gross stuff out of the wound, and then prevents infection. So I didn't buy this. I wouldn't go out and buy this unless you've been recommended to by a nurse, which is what I had been told to do. They gave this to me to use. But yeah, I just figured I'd show it because it's something I'm using. Then you've got the bandage to wrap your arm. I bought 2 of them because that was what was instructed of me by the hospital, was to buy 2 bandages for my arm. And then they gave me like 3 of them. So I think I have 5 in total, which is absolutely enough for the 3 to 4 months that I have to wrap my arm. Yeah, I would say you definitely don't need any more than 5 unless for whatever reason you're a destructo and you're ripping them to shreds or something. I don't know. Mine have been fine. And it's also winter, so they don't smell. I would say in the summer, I would probably have to go through more or wash them very often because of the smell of sweat and stuff. But because it's winter here, they don't smell or anything at all for me. Next, just a box of alcohol prep pads. Like I said earlier, I use them to clean my scissors there in between uses. We were using these for the catheter to make sure the catheter was clean. Like the tip of it, that where the pee was coming out. When you had to change the head of the catheter, we were using this to clean. Just good to have around in general. Then we've got saline. So the hospital gave me a few bottles of this type with the little spray cap there. And every day, I'm still doing this now, but every day, once a day, I have to do a saline spray thing. So basically, I just spray all of the incisions on my genitals with this, and then wipe them up with the 4x4 gauze, like I said. Yeah, so I have this. Nobody said to me, I was told get tons of saline by some people who were giving me advice. They said get tons of saline. What they didn't say was get tons of saline in the little spray bottles. So I went out and bought from the hospital because it was $5. This was like $2.50 or something like that for this one bottle, whereas this big ass 500 ml bottle of saline was only $5. So I went, well, why wouldn't I buy that? So I bought a couple of these, not knowing that I would have to spray myself with it. So basically what I've been doing is I finished all these little bottles, and then you can open that up, and I've been just pouring this one into here, which I know kind of defeats the sterile purpose of it, but I'm not wasting all this saline that I bought, and I can't just like dump this on me. It doesn't work like that. So I needed to do something. So I'm trying to be as clean and sterile as possible with it, and then just still using these every day to spray, because I'm not going out and buying more of these when I bought tons of this saline. So, I mean, you could just go the easy route and buy these, which in hindsight I would have done had I known that I was supposed to. But yeah, I bought these giant 500 ml bottles, which is fine. But yeah, the saline is something I'm using every day. And I figured also if I have extra saline, it's not an issue, because I'm sure that during the next few stages of surgery, I'm probably going to need it to clean things anyway. So if I don't use one of these bottles, then it's not a big deal. And then finally, these are the pee pads. These are just the chair size. You can buy like a bed size pee pad, but these are also from the hospital. These were $5 for 25 of them. And for the first couple weeks, I was using tons of these a day on my bed, because I was naked for weeks. I couldn't really wear clothes for weeks because you have to air out everything. So basically you're laying naked for weeks with these underneath you, catching all the blood, the pee, the pus, the whatever's coming off of you is being caught by these. So I was going through these like crazy. And then you also use these after your shower, because you have to air your arm out for an hour. You don't wrap it immediately after you get out of the shower. So to make it from the shower to your bed, you put this around your arm, so that it's covered when you put your robe over it, so that you're not rubbing your robe against your scar, and possibly causing any kind of infection or whatever. And then you can put this down on the pillow next to you or whatever, so that you can put your arm and rest it on it, and that it's resting on this and catching any of the fluid that's coming off of your arm. So I bought originally only one pack of these. I went through them quite quickly. The hospital gave me quite a few as well, went through those. So I went back and bought 2 packs. This pack, obviously, I haven't opened yet. The other pack, I'm not even halfway through yet. But again, I figured if I overbought these, I'm sure that over the next few surgeries I have, there's going to be some opportunity to use these. So I'm not super worried about the fact that I bought a ton of them and I haven't used them yet. I still use them every day for my arm, and then also you put them underneath you when you're doing the saline spray every day, obviously, is to catch all the saline, because otherwise you just make a mess of your bed. So I'm still using them every day. I probably won't go through as many as I bought, but who knows, maybe I will. So this is all the stuff that I can think of that I've been using, that I bought, that people told me to buy. Yeah, so if you have any questions about like quantities or anything like that, please let me know. Obviously, everybody's different. Every surgeon is different. Their recommendations, the products they use are all different. But this is what I've been told to do, what I've been instructed to do, and what I have been doing. So yeah, but I figured it would be helpful because I couldn't find anything helpful for like what my surgeon was looking for, and what things that I would have to do based on what my surgeon does. So yeah, I figured this might help somebody. Yeah. So anyway, thank you for watching. If you have any questions, if you have any video topics about lower surgery that you would like me to make, whether they're like practical videos talking about my experience, like physically, or if they're videos just about my own emotions about going through this surgery, please let me know. I would love to talk about it, and help anybody out that I can. Yeah, thanks for watching. See ya.